Me for this webinar called 5 Proven Strategies to Grow Your Practice. Today we're going to talk about things you can do to grow your practice, whether you're just starting out in practice, you've been out in practice for a couple years, and you're looking to improve your practice and scale it up. So the first thing is you want to define your niche. So you want to think about who your ideal patient is, and I often say that's like an avatar. You want to think about that person. If you've been out in practice a bit, it's those people who come in, they're really good to deal with, they help to grow your practice. Think about that ideal patient, and those are the people you want to target market with your advertising and your referrals. You want to specialize in high demand areas like sports injury, chronic pain management, family wellness, depending on the type of profession you're in, the type of doctor or therapist. You want to definitely niche down to your expertise, as well as attract certain clients to your clinic. You want to identify your ideal patient and tailor your services to their needs. We talked about that being the avatar. You want to offer premium services like packages, wellness programs to increase per patient revenue in the clinic. What are some other things you can do? You can optimize your patient experience and retention. You can deliver exceptional patient care and ensure every visit provides value. You can implement a structured treatment plan that encourages patient compliance. You can offer memberships or maintenance care packages for recurring revenue. And you can use automated follow-ups and reactivation strategies like text, emails, and phone calls to keep people engaged and to stimulate referrals. We actually use all of those in the clinic. We prefer text now that most people can text, but email's okay. Phone calls are probably better than emails because people get so many emails now. But everybody's different. You've got some patients that prefer email over text. So you really want to get to know your clients, and you want to be able to focus on the best way to communicate with them. Now you want to master lead generation and marketing. So to do that, you want to utilize Google and Facebook ads to attract local patients. And we're constantly working on that. We've hired experts to help us here in the clinic. We have run experiments, A/B or split testing. We're trying to improve our ads all the time. And we did really well with Google ads last year. And we're trying to improve our Google ads, but also our Facebook ads this year to do better. So we want to be in that number one spot here in our local community, both for Google, which we are, and for Facebook. You want to optimize your Google My Business profile for visibility. Very important, because what it helps you to do is rank better for SEO. It also helps people when they're looking on a map to find you and your clinic. You want to create high converting lead magnets. Now, a lead magnet is something that you're giving away or offering to attract people, so to generate leads. So free consultations might be a good way, depending on, again, what kind of doctor or therapist you are. But health guides are good too. Tips, things like things that people can do it yourself at home, things to watch out for. People really like that. That provides value to them. You want to implement a referral system, reward existing patients for bringing in new ones. So some type of reward for bringing friends and family members to the clinic, telling others. Most of the time people are pretty excited and they do want to tell others about you, but sometimes you might need to stimulate those referrals or kind of get that program going in your clinic. Increase revenue per visit. You want to offer cash-based services and products like orthotics, supplements, shockwave therapy. One service that we don't like to bill directly to insurance are orthotics. We offer an incentive, 10% off, for the patient to be able to deal with the paperwork, because we find it very cumbersome for that one service. So we give 10% off. People pay up front, get the paperwork, submit to their insurance. They usually get paid back faster than we would for that service. And in the meantime, we can focus on getting the order in, making sure the patient's happy with the product. So that's just an example right there of a cash-based service and product. You want to introduce bundled packages. Some of these bundled packages would be like 10-session treatment plans. When you set up a treatment plan for a patient, it gives them some structure, something to follow with clear and realistic expectations. But you might want to give a bit of a discount for the patient following through on the treatment plan or coming for those multiple sessions. You want to train staff to upsell and cross-sell relevant services and products, I would say. So depending on that person and what they're going through and experiencing, there may be other services that apply to them or even products that can help them. To scale your business, you want to automate patient bookings. You want to provide reminders to patients to cut down on missed appointments and canceled appointments. And you want to follow up with them. A good time to follow up is early in the treatment process. When they first start coming to your clinic, you want to let them know that you care and you're there for them. So very important, those quick follow-ups. Again, we do a lot of our follow-ups using text here in the clinic. You could hire someone, especially somebody who's well-trained, like a kinesiologist or a medical assistant, a nurse, to help you in your practice. You can hire an assistant, somebody to assist you with some of the time-consuming tasks that you don't need to do, or even a virtual admin to free up your time. You want to document processes so your clinic can run without you. So procedural manual is always a good idea, and then updating that procedural manual as your clinic evolves. So very good for staff to refer to or refer back to so they know exactly what they're doing, but also for you to update as your procedures change and adapt to the growing environment that you're going to be in. You also want to consider adding a locum or a relief doctor or even an associate to serve more patients in your practice, especially when there's downtime, maybe when the clinic is sitting dormant, and a doctor or therapist can be working in your clinic seeing other people. Do you want to know more about scaling up your practice and improving the patient volume and the services in your clinic? You can get our free guide by clicking on the link in the bio, or you can comment below, free guide, and we'd be happy to send you the 5 steps to scaling your practice. It's free. All you have to do is click on the link in the bio or comment below in the show notes. You can also join a free webinar. We host these webinars on Eventbrite as well as on our website. So you might want to follow our website or even sign up for our newsletter or our for notifications on YouTube when we're going to have these webinars. You can also sign up for a group like a mastermind group or one-on-one coaching today if you need extra help. We still have some spots available right now, so you could sign up for the next mastermind group. There's a waiting list for that, and then there's still some spots for one-on-one coaching at this time. I want to thank you for joining me here today, talking about ways to grow your practice, and I hope to see you soon.